A diagnosis of breast cancer can be devastating. There are so many facets to the treatment process, even deciding where to turn next can be overwhelming. In Southwest Florida, we found Regional Breast Care, a facility that's dedicated to the care of breast health issues. Dr. Rie-Aihara tells us more.
We're the only practice that specializes exclusively on breast health issues, whether it's benign disease or malignant disease. And we are located in the Regional Cancer Center, and that really helps us to provide patients with an overall treatment plan, not only medical, but other ancillary services such as support groups, yoga, nutritionist, genetics, and we're also partnering with all the other subspecialists such as the radiation oncologist and the medical oncologist. And so it provides us with an environment where the women can come to one place and actually have all the services there rather than having to go to different places in the city. And I think one of the worst things about this disease is having the fear of the unknown, and once we're able to discuss all this with the patients and come up with a treatment plan with in conjunction with all the other subspecialists, I think that helps the patients through this process.
Dr. Aihara explained that all treatment regimens are not the same.
When a woman is diagnosed with this with breast cancer, we want to offer a personalized approach in a very compassionate setting, and that we are trying to provide medical expert care and also at the same time to help relieve the anxiety by trying to shorten the time of waiting so that we can have the women see subspecialists as well as myself in a very timely fashion and come up with an overall treatment plan that is best for each particular patient.
We ask about advances in detection of breast cancer.
The key is to identify these cancers early so we can increase the survival. Now, in the past, maybe 20, 30 years ago, most of the lumps were found by women themselves doing a self-breast exam, and we cannot stress the importance of continuing to do so. However, with the adjunct of new modalities such as digital mammography, breast ultrasounds, and breast MRs, we're actually finding more and more non-palpable lesions, both benign and malignant. And at this time, the only way we can tell whether or not a tissue is truly malignant is through biopsies, whether it be stereotactic biopsies or surgical biopsies. So every day as clinicians, we are looking for another method, a less invasive method, to try to identify these tumors that are malignant. And one of the very promising new technology is called elastography. And how we use this in breast is that when you apply pressure to normal breast tissue, it becomes very compressible, and if you will, you can demonstrate, let's say this is a normal breast tissue, you can tell how pliable when you apply pressure with your hand, it actually conforms and changes shapes. Whereas a malignant cell, if you have a tumor, is more like this marble, which is very firm. And when you actually apply pressure onto it, it does not give. So these are two different properties of tissue stiffness that is seen in normal and malignant tissue. There are many studies out there that are studying elastography, and it looks very promising. And comparing to tissue biopsy, some of the studies show up to a 98% accuracy in determining malignancy in certain tumors. So although we're not completely there yet, I think further studies are still underway, and it looks like a very promising tool to help us become more and more, or less and less invasive.